I chose to become a practitioner because of my life experience. When I was 8 years old, my mom was diagnosed with breast cancer, and we did a lot of things that were different to what other patients were doing at that time. So we went through our products at home, our diet. We made a lot of changes as a family, and even though she was still doing conventional treatments, I really realized at a young age that these changes are probably what enabled her to live a longer life, and that really stuck with me. And I think that there's a message in that for all of us, that our environment, our diet, our lifestyle has such a huge impact on our quality of life. And I still carry that with me today. I like really complex cases, and especially the patients that come in and they've got a story, like they've been told their pathology is normal and their symptoms are almost ignored. And so I really like the cases where I have to sort of play detective and dig a lot deeper into what's going on, especially with metabolic conditions, hormonal conditions, autoimmune, digestive issues. I pretty much like everything. I think people are surprised when we talk about symptoms being messages from the body. So it's like the body is communicating to us through our symptoms, and I think that surprises people often. In functional medicine, all our body systems are connected. So the gut communicates with the brain communicates with hormones communicate with our immune system, and it's all interconnected. And I think that's really fascinating. So when we look at patients, we look at the whole story behind that patient's symptoms and conditions, not just one chapter. I am here to help you, and I will listen to your story, and I will be like a functional medicine detective and really try and get to the root cause of what's going on. And I will educate you and empower you and help you live a better life. I had a patient a couple of years ago. He was a male in his early 40s, and he'd been struggling with chronic migraines weekly since he was a teenager. And yeah, terrible. And when he came in to clinic, it was like he was a shell of a man. He couldn't do the things that he wanted to with his 2 young boys. He wanted to take them fishing and camping. He struggled to function at work and had been on and off different pharmaceuticals throughout his lifetime, and really felt that nothing could help him. And so we did some functional testing, and from those results changed his diet, changed a few things in his lifestyle, and within 3 months his migraines had stopped. It was really amazing. And then when he came back into clinic, it was like he was a new man, and he was showing photos of how he was going camping and fishing with his kids, and it really changed his life, and it changed the lives of everyone around him and his family. And it was just really beautiful and rewarding to be a part of that. So I still hear from him every so often. He'll send me a photo of a camping trip or fishing with his kids. But he's great, he's migraine free. So it was a really beautiful experience. I would like to shift the focus away from treating symptoms and more about prevention and root cause medicine. Rather than just offer band-aid care, we can look deeper and prevent chronic conditions from occurring in the first place.